My name is Edward McGillicuddy. I'm a vascular surgeon at MaineGeneral Medical Center. I'm a board-certified vascular surgeon. I did core general surgery training at Yale New Haven Hospital in Connecticut, and I did my vascular surgery fellowship, specifically just in vascular surgery, at Brigham and Women's Hospital in Boston. In vascular surgery, we provide broad-based care for blood vessel problems. That blood vessel problem may be in your neck at a carotid artery that's causing a stroke or mini stroke. It may be related to arms when people need dialysis access so they can go on life-saving dialysis, aneurysms of the abdomen, blockages in the legs. So vascular surgery is interesting because we're using different types of technology all over the body. In addition to those surgical procedures, we provide follow-up in our office. We counsel patients and consult with patients in our office, and we have a wonderful vascular laboratory where we do a lot of ultrasounds. Ultrasounds are really important in vascular surgery for looking at potential diseases of blood vessels. Vascular surgery is interesting in that there's lots of different ways to treat a patient. And so one of the things that we often do is we talk about our patients in a group, 3 or 4 vascular surgeons and our mid-level providers around a table saying, here's this patient, let's talk about the imaging, let's talk about what's going on, how we can best tailor the approach to them. And I think that's one of the beautiful things about working at MaineGeneral Medical Center. We've got the technology to treat patients with cutting-edge things that I think are really current in vascular surgery and lead to a good outcome. But we can do so in an environment where you don't necessarily get lost in the shuffle. Our goal is to see patients quickly, see patients, get them in for access, and then talk to them and see if indeed they would benefit from a procedure and really tailor that procedure to them. Sometimes if you show some x-rays or a patient presentation to a patient or provider, there's 3 or 4 different ways to treat that. And so we really try to tailor our therapy to that individual patient and get them a good outcome. Well, one of the things that's interesting about vascular surgery is although we have vascular surgery in our name, a minority of our patients actually get an operation. And often when we're meeting patients in the office and we're going through risks and benefits and alternatives, we don't necessarily need to push patients into surgery. A lot of people just need reassuring. A lot of people need, let's look at your CAT scan, your ultrasound, your x-ray, and talk about this. Let's look at the risks. And so we don't have that mentality that everybody walks through the door needs a surgery or they're wasting the surgeon's time. In fact, lots of times we're talking about here's why we shouldn't do surgery. And we like to look at those patients and clearly say, okay, here are benefits and risks. And when that decision-making process makes sense, then we proceed to surgery. But by far, most people, often people do not need a surgery. I think what I can do here, and one of the things I can contribute at MaineGeneral Medical Center is my passion, my love for vascular surgery, my love for anatomy, my love for patient care. And I think that passion kind of bubbles out of me, and I'm hoping that people can see that, families see that, and patients see that, nurses see that, the ER doctors see that. And I think if you bring that passion and you really have that zest for what you're doing, it's more than just a job, it's more than just a profession. It kind of incorporates all the things in your life into your patients, into your practice, and it gives you the best possible outcomes for your patients.